poo is not really something we like talking about, and it's certainly not something we like having to deal with. So when our pets get diarrhea, it can be a real problem. And getting home from work and having to clear up diarrhea is not anyone's idea of a good time. So what can we do about it? Well, as vets, we know that often diarrhea in animals is caused by infections or inflammation within the gut. And for a long time, we've treated these issues with either antibiotics or anti-inflammatories, which usually involves steroid usage. However, more recently, in human medicine, they've started looking at some of these infections that don't respond very well to antibiotics and looking for alternative treatments. And there is a technique called FMT, which stands for fecal microbiome transplant, which can be used in people with various forms of infection or inflammation in their gut. It can be very effective at treating a type of infection called Clostridium difficile, which people get in hospital. It's not very sensitive to antibiotics. In fact, only about 27% of people given antibiotics will respond to it, whereas with FMT you can get response rates of 87 to 100%. So we've started using these techniques in veterinary medicine to treat infections and also treat inflammation within the gut. And so far, the results are really encouraging. We're getting very good response rates to these. I've treated a cat recently that had such severe diarrhea that he was unable to go around the house. He was locked in the downstairs bathroom all the time because he was just dripping poo from his bottom. And after a single fecal transplant, he didn't pass any poo for a day and a half and then has had formed stools ever since. So we can have really, really good results without long-term treatment being needed, without having to use lots of antibiotics, which we're always not keen to do because we know that can lead to problems. So if your pet has diarrhea, it's worth going to the vet and having a chat to them about it. And if they want any advice about fecal transplants, they can give us a call at Highcroft to have a chat to me. My name's Kerry Simpson. I'm a specialist in internal medicine.